And also with us, we have the Chief Executive, Dr. Caroline Turner, the Director of Transformation, Ness Young, the Director of Environment and Economy, Nigel Bryn. Our Director of Social Services, Alison Bullman, can't be here today. You won't be surprised to hear she's extremely busy. But we have the Head of Commissioning in Social Care, Dylan Owen, here. The Head of Finance, Jane Thomas, is here. Monitoring Officer and Chief Legal Officer, Clive Kinney, and Chief Officer for Education, Lynette Lovell. And the Senior Manager from Communications is with us as well. I think John is with us. This is a formal meeting. It's our first Cabinet meeting for quite some time. We invoke the Corporate Business Continuity Plan, which we always have in place, but we invoked that when we could see that COVID-19 was becoming very serious. And we've only been dealing with areas of work that are critical in keeping the crucial services and the Council running. Now, our agenda is based on those items only today. So to go to the agenda, and the first item, as always, is apologies. And I'll put in an apology there for Councillor Phil Davis in case he's not able to join us later on. We do have some connectivity issues here in Powys. The next item on the agenda is declarations of interest. And are there any declarations of interest? No. We can always pick them up later if there are none at this point. And the next item, the first item really on the agenda, is the business critical areas of work. And I'm going to ask the Chief Executive, Dr. Caroline Turner, to come in and explain what those areas of work are, and then we'll go through some of them by exception. You'll understand, everyone watching, that we have been going through these items very, very regularly. So I'll bring in Dr. Caroline.
Thank you very much, Leader. Just to explain that as a local authority, we invoked the Corporate Business Continuity Plan very early on in this health crisis. It was invoked on the 18th of March. And what that enabled us to do was step down any non-critical activities. In fact, social services had already invoked their business continuity plan 2 days earlier. A key element of the Corporate Business Continuity Plan is the agreeing and reviewing the business critical activities. Very early on in the process, we'd identified 9 key priorities, but we have kept them under regular review. We've reviewed them every fortnight, and the current list of business critical activities is published with today's agenda. There are 13 business critical activities currently under 3 headings: so responding to COVID-19, keeping our community safe and resilient, and corporate issues, running the council. And more recently, we've added beginning to plan for recovery as well. So that is something we are now doing some very early work on. So that is the framework really for our priorities as a council at the moment. And I'll hand over now to Ness Young, who's going to explain how the business continuity plan works in practice on a day-to-day basis.
Thank you. There's a clear formal emergency response structure in place, starting at a national level with the Welsh Government, who has an emergency command centre. Feeding into this are 4 local resilience forums in Gwent, North Wales, South Wales and Dyfed-Powys. We are part of the Dyfed-Powys LRF, and I represent the council on this group, providing daily updates and meeting with their strategic command group twice a week. Internally, we have established a Gold Command Group comprising the Executive Management Team, the Head of Comms and a member of our Emergency Planning Team. I chair this group, which meets daily and also includes the chair of our Silver Command Group. The role of Gold Command is to set the strategy and oversee our response to the pandemic. Our Silver Command Group is chaired by Gwilym Davis, Head of Property Planning and Public Protection, and is made up of all of our heads of service, plus a communications officer and someone from the emergency planning team. Silver also meets daily and is responsible for operationalising our response and providing daily situation reports to Gold on our business critical activities. There are a number of multidisciplinary operational cells that report to Silva on areas such as social services, PPE and excess deaths. The Council is also represented on the Powys Teaching Health Board Gold Command by Ali Bowman, our Director of Social Services. Ali is also representing all of the Directors of Social Services in Wales on a Welsh Government Social Services group. And finally, Dylan Owen, our Head of Commissioning, also represents the Council on the Powys Teaching Health Board Silver Command. The Council's Gold and Silver Commands have recently been reviewed and have been concluded that they continue to be appropriate and effective. I'm now going to pass over to Councillor Myfanwy, who will touch on our adult social services business critical activity.
As I'm sure we all agree, this has been an extremely challenging and indeed a tragic time for many individuals and families here in Powys. But I can give the strongest assurance that through the hard work and dedication of our teams and our partner organisations, we've been able to deliver some key objectives. One of the first things that we needed to do was to relieve pressure on our district general hospitals, which aren't of course located in Powys, but who again are key partners, by allowing more people to return to community hospitals or to their own homes. And our current largest focus is to do with support for our care homes, where we are providing services to help broker in additional support for those homes where the infection is present, and to keep infection control as a high priority in all of the homes. The staff have, I'd like to take this opportunity to thank the staff for their amazing work and dedication. We've also been key in the coordinated provision of protective equipment throughout the county, and in the future I regard the rollout of the testing programme as possibly our next largest challenge. I'd like to pass over to Dylan Owen, our Head of Commissioning.
Thank you, Myfanwy. Welcome, Dylan.
Thank you, Pnawn da. Social services went into business continuity on the 16th of March, and since then we stopped all non-critical activities and have been focusing solely on the critical services. That's about safeguarding, supporting the care homes, domiciliary care, supporting people with substance misuse, supporting people to transfer home from hospital, providing information and advice, and supporting unpaid carers. We've been focusing on preparing emptying hospitals, increasing capacity, bringing people as close to home as possible in order to be prepared for the work ahead. We've been working very hard in trying to support all of our providers, the domiciliary care providers, supported living providers, the residential and nursing care home providers, in order to ensure that they are ready, that they're able, that they're well equipped, and that they are able to provide the services that we commission from them. We've been block booking a number of beds in order to increase and maximise the capacity that we had in preparation for any potential surge. We've also been providing, as Councillor Alexander explained, the personal protective equipment, or PPE, and we have sufficient stock of that across the county. We've also been working with the care homes specifically in order to understand how we can help them best, and to be sure that we understand what their pressures are. We've been doing that with the health board, working closely with them in an integrated manner. We do now have an integrated multidisciplinary team that meets on a daily basis, going through all the issues that are arising from the care home market. We are contacting them every day, and we are also having weekly meetings with them. In order to support these services, we have redeployed a number of staff, hundreds of staff. In fact, we've provided mutual aid in so doing. So we do have a number of our council staff who are now working within other sectors, including the third sector and the private sector, in order to ensure that these homes and these closed settings are sustainable and are safe. We're also obviously working very closely with PAVO and the volunteer sector, the voluntary sector, with what they call CSIRT, in order to ensure that we're able and enabled to provide support to people in the community which isn't eligible for what we would call acute social services. Diolch, thank you.
Thank you very much, Dylan. Now, I think we're going to go to childcare, education, the whole area there where we've had to work, and I'm going to bring in Lynette, although Councillor Phil hasn't joined us, has he? No. I would normally ask Councillor Phil Davis to introduce this item, but we'll go straight to the Chief Education Officer, Lynette Lovell. Thank you, Lynette.
Thank you, Leader. First of all, I'm going to just give you an update on the emergency childcare hubs. Emergency childcare hubs were set up and commenced in Powys on the 27th of March 2020, a week after the schools were closed and repurposed. The purpose was to provide childcare for key workers and vulnerable children. There are 15 childcare hubs for school-age children, which include two childcare hubs for our most vulnerable learners in special schools in Prue. For children who are not school age, that's from 0 to 4, there are 28 settings across Powys and approximately 154 people are attending. Hubs operate from 8 AM to 6 PM, 7 days a week, and we're open over the bank holiday Easter weekend and will of course be open this coming bank holiday weekend. Numbers in the hubs for school-age children prior to this week ranged from 148 to 163 across the local authority. We've seen an increase with numbers this last week up to 245. This is mainly due to the intentional work with children's services, ensuring more vulnerable learners are accessing the hubs. Cross-service working has been a strong feature of the setting up of the emergency childcare hubs, with service areas such as catering and cleaning and transport providing the support, which has included 3 meals a day and cleaning all through the day in the hubs. Also, there's been joint working around the vulnerable learners with children's services, the youth and the sports development officers who have been regularly at the hubs to provide physical activities for the children. PPE is available in all the childcare hubs. In the 13 mainstream hubs for school-age children, PPE is available for dealing with pupils who may display symptoms and need to be isolated with a member of staff until they are collected by their parents. In the special childcare hubs and the early years, PPE is also available for feeding and/or intimate care. Tests are available for all staff in the hubs who may be displaying symptoms. Regular meetings have been held with the head teacher leads of the emergency childcare hubs. Weekly, daily at the start and now weekly. The head teacher leads and the other head teachers in the cluster are the leaders in that area. I'd just like to say a huge thank you to the staff, to the teachers, to the head teachers, to the catering staff, the cleaning staff, the sports development officers, the childcare workers, the support staff, and our own service officials who have helped to ensure that we were up and running in Powys with the childcare hubs within a week, and that they have been successful as we go ahead at these difficult times. Thank you.
Thank you very much for that, Lynette. I'm going to move on. We've got a whole area of finance and the management of cash. I'm going to put that into the next item on the agenda. But for the rest of this agenda, this particular item, now, are there any items on public protection, that sort of work that need to be flagged up? And I'm asking that of Councillor James Evans and Nigel. Is there anything there that we need to know about at the moment? Obviously, we're being briefed along the way. We're well aware of that. No?
Sorry, Leader, I'm having some technology issues. I did want to come in if that's okay.
Yes, certainly.
Yes, in public protection. Yeah, staff in public protection are working very hard with our colleagues in care homes under disease prevention, disease control. So giving continuing advice there. We're also working with Powys Teaching Health Board in preparation for contact tracing. There's also enforcement going on at the moment, so that's enforcing people coming into the county shouldn't be here. We're also looking at our caravan sites as well, and also probably like holiday lets as well, to make sure that people aren't advertising those and people coming into the county. And we've also give prohibition notices to people and fixed penalty notices. And we're just making sure as well, working very closely with that sector, if anybody wants to open up accommodation for key workers as well. So we're providing a lot of support to people to do that as well. And we're just advising retail as well on the social distancing measures, which they now have to do, which come in from Welsh Government not so that long ago. So I'm not sure if Nigel wants to pick up on anything, but they're just some of the headlines in public protection at the moment.
Yeah, appreciate that, James. Thank you very much. Nigel?
Leader, I think it's been well covered by Councillor Evans. The only other significant area of work is, of course, trading standards and advising our residents against potential scams that we're aware of during the outbreak.
Okay, thank you. And you have also been involved in setting up the temporary mortuary.
Yes, sir.
Yeah, could we pick that up at the end, Leader? Probably that might be more relevant, if that's okay.
Okay, fine. All right, I'm going to skip out support for businesses, and we'll talk about that later on. Councillor Halwyn, is there anything you wanted to bring up about refuse or highways? They've done a wonderful job continuing to collect the refuse.
Yes, thank you, Leader. No, the service is operating very, very well. Very pleased and very grateful for the support that the staff have offered the service, and you know, everything is running over and above what our many neighbouring local authorities are able to offer. So we are in a very fortunate position there.
Tremendous, thank you. And briefly, anything there on children's services and safeguarding, Councillor Rachel?
Thank you, Leader. Just to say that we're constantly reviewing and adapting the business critical services. Definitely PPE has been critical in allowing social workers and support staff to meet children, young people and families face to face. So we're constantly adapting our service to meet the needs. We have had low workforce absences. The testing processes has had a positive impact on COVID-19 related staff absences in children's services. Morale and stability within the service is very good, and we've recruited 3 additional social workers throughout this time. Positive working relationship with education and our partners, especially as outlined by Lynette Lovell in view to the childcare hubs. And again, placement strategy remains a priority, as is increasing foster carers. So we've really, as a service, I have to commend them. They've adapted constantly in view to the COVID-19 crisis, and really have been exceptional. But obviously there's still work to continue, but all good. Thank you.
Thank you very much for that, Councillor Rachel. Now we'll move on to corporate support, Councillor Graham, and that includes workforce, communications, all sorts of things. And I know you've been very busy, Councillor Graham.
Yeah, thank you, Leader. Yes, it's been a very busy time. And I'm going to start by paying tribute to the hard-working staff in ICT, corporate support services, communications and workforce for continuing to respond magnificently to the demands we've placed on them by what really are unprecedented situation we all find ourselves in. It's really important that the council and the public fully appreciate the way council staff are responding, I think, and not just in the departments I've mentioned, but indeed right across the council workforce footprint. I think that should be mentioned. It's really quite remarkable the way everyone's adapted to either working remotely or taking on new and emergency roles within the organisation. I'm going to start with communications. Demand continues to remain high, and additional staff who were redeployed remain in place to help the team cope. In the last week, for instance, we have seen continued high volumes of traffic on our social media sites. 215,000 interactions, a slight reduction on the previous week, but nevertheless a high figure. 185,000 plus views on the web page, an increase. 1,470 customer service calls, which stayed the same as the previous week. 270 personal budget calls, a small reduction. 530 housing inquiries, which was an increase. 230 inquiries for health and social care support, an increase, and 600 council tax and business rates and housing benefit inquiries, which was a small reduction, and they've all been efficiently dealt with. We're increasing our business intelligence, business information, grant allocation, claim forms, etc., and safeguarding measures have been built into a dashboard so that we will have accurate information at our fingertips. And that takes me to HR matters. Overall absence across the council has improved slightly and is now at 8.06%, which equals 461 staff, which is lower than the 10% average across Wales, I'm pleased to say. 282 are absent due to COVID-19, ill health, shielding, etc., which is slightly down on last week's figure of 286. Councillor James mentioned contact tracing, which is going to be a major role for us. We are looking at this now, and this will be a major and multi-agency response, which will require a lot of staff and needs to be up and running soon. We have a key meeting tomorrow with the PTHB to scope this. It's as we come out of lockdown in Wales and the UK, we need to be able to trace people who are symptomatic and ask them to isolate, etc. We would trace who they came into contact with and go through a script to see if they need to isolate as well. England are also testing a smartphone application, as I'm sure most of us know, in the Isle of Wight this week, which traces who you come into contact with, and this may well be used across the UK going forward. We will need a multi-agency approach to set up the contact tracing team over the next week to be ready, with the aim of being to lift the lockdown in the safest way possible. Doing this will require a significant increase in surveillance, sampling and testing and contact tracing, which in turn requires a combination of human work and technological support. So for this to work effectively, we need the public to understand their role in the next phase of the pandemic response, to engage with contact tracing and any relevant technology, and continue to follow public health advice and social distancing requirements. In our legal services department, the registration service, death registrations are being undertaken by telephone. Existing staff are coping at the moment, but 7 extra staff have been trained to deal with any surge should it happen. Birth registrations have been suspended nationally since March the 27th, but luckily we only have 26 outstanding in Powys. Civil ceremonies, we are following national guidance on social distance, and all but one have been cancelled or postponed, and we await further national guidelines on that. In legal services, we continue to support business critical activities with children and adult services and public protection. Other staff have been redeployed to support welfare calls and PPE procurement. And in democratic and member services, the service is reduced, but adequate support continues for members and cabinet. New Welsh Government regulations have been issued to allow remote attendance at meetings, and we welcome a return to scrutiny this week. And the AGM has been delayed, but has to take place before December the 31st. Thank you, Leader.
Thank you very much for that, Councillor Graham. And it just serves to remind me how many services any county council does provide, actually. Now, I'm going to, I don't know whether anyone has anything extra that they want to add, but if not, I'm going to pause that area, that item on the agenda, and we'll go on to finance. I know it's the next item on the agenda, but it's also very much a part of our business critical activities. I don't think anyone is wishing to come in. Yeah, sorry, Ness, yes, come in.
Shall I update on where we are with our welfare calls before we move on?
Oh yes, fine. Yeah, sorry, Ness. Yes, please come in.
The council has made welfare calls to all the individuals in the county who have received a letter from the government or from their GP advising them to shield. So far we've called 4,681 individuals. And from those calls, we have identified those who need support with food, prescription, medication collection, and also people who've asked for a follow-up welfare call. of which we're doing 1,500 follow-up calls to individuals. We've worked very closely with the community sector emergency response team to link individuals with volunteers to be able to provide that support. In addition, we have made over 1,600 calls to our Careline clients, and of those, nearly 900 have also asked for a follow-up call. So we've got a team of officers, many of which have been redeployed from other areas, who are conducting these calls and making sure that our residents feel safe and supported during this time. We are expecting an additional cohort of individuals as the government has yesterday issued further letters to individuals to shield in terms of adding kidney dialysis patients, individuals with a broader range of lung disease, and also extending the groups of immunosuppressant medications in terms of those individuals who also should be shielding. So we'll continue to make those contact calls and also the follow-up calls over the coming weeks. Thank you.
Thank you very much for that, Ness. Sorry, I should have picked up that point before. I just wanted to add there, really, and from a very human angle, I had a lovely email from somebody in my ward who'd had one of those calls, and she was thrilled that there'd been a call at all. And I think it's very important that we remember that this is quite a frightening, lonely time for a lot of people, especially if you're not very strong, very well anyway. So thank you for that, Ness, and thank you for all that's being done. I know it's a big exercise. I'm going to move on, as I said, to the next item, the next area of work, which is finance, very much a part of the work that we're doing, because we have to manage our cash, obviously, as we move along. And this includes the loss of income that we're experiencing, the extra cost pressures, the grants that we're having to administer. And to start this item off, I'm going to ask Councillor Aled to come in, and then we'll ask Jane to follow on. Councillor Aled.
Thank you, Leader. And can I thank Jane for pulling this report together. It provides the Cabinet with an early indication of the potential impact of COVID-19 pandemic on the Council's revenue account. Clearly, the figures contained within this report are quite frightening. We're looking at potentially additional costs or the net impact, about 3.4 million every month. So that's over £10 million in the first financial quarter of the year. Jane will touch on the different areas, the additional costs we are facing, the loss of income, the impact on council tax, and also hopefully Jane will go over our reserves position. The reserves we carry are sufficient for normal situations, but this is anything but normal. So without any further words from me, over to Jane. Thank you, Jane.
Thanks, Ollie. Jane.
Thank you very much, Leader. Yes, the report before you gives you a very early indication of the potential impact that COVID-19 pandemic is going to have potentially on the council's revenue budget. I think it's clear that the changes we've seen both within and outside the council are having a significant financial impact across the board, and it's vital then how we assess how this is going to potentially impact on the council's budget. There are many unknowns, and it is still difficult to accurately reflect the impact with any certainty, as things are constantly changing, and the projections provided within the report will need to be updated regularly to reflect the rapidly moving situation. The impact on the revenue budget has basically been assessed in a number of categories, and the main areas of potential impact, as indicated by Councillor Aled, are around additional costs, the loss of income, council tax and non-domestic business rates and the impact on collection of those, together with the impact on the delivery of our savings. The council has proposals of just over 10 million for delivery during this financial year, and due to the changes in the way we're delivering services and directing resources to deal with the pandemic means that we are potentially going to see delays in the delivery of those, or even unable to deliver some in full at all.
On the upside, though, we are seeing some cost reductions and underspends in some areas, and that is as supplies and services are not now needed for some services. So we are obviously seeing some underspends across the board as well. We have had funding from Welsh Government, and we've seen some additional funding that's been allocated to deal with the additional costs. Those cover a number of areas of activity, including social care activity, and we are claiming back those costs on a monthly basis. So a huge task across all services and the finance team to make sure that we claim those in a timely fashion. The table then in the report does show each of those categories and the potential impact that that would have on our financial position for the 2021 financial year. And as Councillor Allard indicated, it could potentially be a deficit of around £3.35 million a month. That would equate to a deficit by the end of June, all things remaining the same, of over 10 million. So if that were to be the position we would find ourselves in, then obviously our reserves would be the first point of call to meet any deficit. And the reserves table shown in the report shows that the general fund reserves and the budget management reserve that we hold to manage some changes in budget total 13 million. That would obviously provide coverage of a deficit of around 10 million for just over 4 months. So not a significant level of reserves held to deal with this situation. We do have other specific reserves, and I think the first thing we will do now is review those as well to see which of those could potentially be released to support a deficit if we were in that position. I think it's fair to say there is a lot of work ongoing across Wales. You know, the position we find ourselves in is not unique to Powys. All authorities are facing the same difficulty, and we are in regular communications and discussions with the WLGA and Welsh Government about the impact this is having on each authority, and that is something that's being considered at a national level, and we've completed work to inform that discussion, so we will keep an eye on those discussions. But we obviously have to take some steps ourselves to mitigate the loss that we could potentially face, and section 5 of the report, and in terms of the recommendation in this report, is that we now progress each of those actions to look to limit the deficit as much as possible. And those are listed there. They will include looking at whether or not there is an opportunity, or whether we want to consider the furloughing of council staff, a delivery in terms of the budgeted cost reductions. We need a more detailed review of that to see what can be delivered, and if we need to reprioritise some areas of work to make sure that we can do that. We will be limiting expenditure on all but business critical activities. The capital programme will need further review as projects are halted or delayed. Obviously that then has an impact both on the capital elements but also our revenue budget, so we need to be clear about that, and to further review the reserves to see what can be released if need be. So the council really has to take every opportunity it can to reduce costs and limit the financial impact on its budget. That's a very quick overview, but I hope that gives Cabinet some information and whether there are any questions.
Thank you very much for that, Jane. That's very helpful. I just wondered whether either of you would like to add anything about the administration of the business grants that we've been involved in. I know that's also been a huge project.
Yes, I'm quite happy to add to that. We've end of the financial year, beginning of the new financial year is naturally a very busy time for the finance team. So I must congratulate Jane's team for getting out that business grant. I think we've had 3,500 individual grants sent out to various businesses across Powys. We've processed 98% of the applications by now. We've paid out about 92%. I think we've got another 1,200 applications or businesses who have not applied for their grant yet. Clearly, it has been a fantastic effort by the finance team. It's important that we try our best to support our businesses across Powys, and we still await for the last tranche of funding from Welsh Government to help with that funding. We've actually pushed out more money than we've had from Welsh Government to date. So it's important that Jane and her team keep on top of this, because cash flow for the council is extremely important, and it's a huge amount of work to be done there. Can I also touch, Jane did go through those various areas. We've had an initial indication that the council tax income has fallen by about over £600,000 in this first month of the financial year. We're keeping a close eye on that. And the 5 areas, section 5, where Jane touches on all those very sensible actions that we need to take forward. It forms part of the recommendation at the end of the report, but hopefully Cabinet can agree to sanction those the recommendation. Thank you, Leader.
Thank you very much, Councillor Allard. Are there any questions on that? I feel I should tell you, I was talking to somebody from Business Wales the other day who said that Powys were one of the first to start getting the business grants out, and he thought that was extremely impressive. I think it's important that I pass that on to you. I know that you were very organised in doing that, and thank you for that, because our businesses will need them there when we come out of this. Are there any other items on the business critical item that we need to talk about? No, I think perhaps I'd better just very quickly mention the things that I've been doing, that I've been involved in, and the Welsh Local Government Association have arranged meetings. We were meeting every morning, and we were meeting for at least 3 mornings of the week with a whole range of ministers from Welsh Government. That was extremely useful to us. We still meet with ministers. We meet twice a week now. I also meet with the Local Government Association, who are based in London. We've met with the Secretary of State for Wales, and there's a meeting arranged with the Secretary of State for Local Government from Westminster shortly. We've had meetings with cross-party leaders within the County Council so that all the political groups are kept up to speed. We've arranged a members' briefing for this coming Thursday so that the wider membership know what's going on, but of course they've been kept in touch with everything anyway on email. We meet regularly as a cabinet management team. We've also had meetings with our own elected MPs and AMs, and that's the regional AMs as well as the local ones. And I think it's been appreciated that we've all kept in touch. It hasn't been the easiest time at all, but we try to keep everybody informed. If there's nothing else on that agenda, I think we're drawing to the end of our meeting.
Leader.
Go on, Alex.
Sorry, can I just very quick update? We've been waiting for software before resending business rates bills out. So just to inform you that the Retail, Leisure and Hospitality Relief Scheme has now been sorted, and we'll be sending out the bills or 0 bills to 1,260 businesses tomorrow. So just we've been waiting for that software update for a couple of weeks now, and businesses in those sectors will get a 0 bill tomorrow. Thank you.
Thank you. And I can't let this meeting pass without mentioning the fact that we did lose a member of staff about a week ago, one of our care staff, Sharon Scanlon from Brecon, and our thoughts are with her family. And also our thoughts have very much been with our colleague, Councillor William Powell, who was in an induced coma in Neville Hall Hospital in Abergavenny for almost 3 weeks, but it's very pleasing to note that he's making a good recovery now, and I have sent him a card on behalf of the Cabinet. And in terms of all that everybody has done, and by that I mean the officers who've been working in the front line, all the officers who are with us today, and many staff who are working quietly in the background. The word thanks seems inadequate, but we do very much mean thank you from all of us. And I would include in that all the Cabinet members. Everybody's been extremely busy, And I would say thank you to the wider membership. Of course, members are involved in working in the communities as well as involved in meetings and passing information on. But thank you to all of you. Thank you for taking part in this meeting today. It's been quite an unusual meeting. We must be spread over a distance of about 135 miles altogether. I know Aled and I live a very long way apart, and of course our Chief Executive is some way apart, and most of our staff. Thank you very much for taking part. I hope that people will appreciate the fact that we've shared as much as we can. Thank you all very much. Thank you.